Good morning, Ma'am Elaine Gabaran. My name is Monica Pasco, your student nurse for today. What would you like me to call you?
Just Elaine.
Okay, Ma'am Elaine, I will be assessing your thorax and your lungs. For the procedure to be successful, we need to take off your shirt later on. So, is it okay with you?
Yes.
Okay, I will be checking your circulatory and respiratory rate to see if you have any abnormalities. Shall we start now?
Yes.
Now we're gonna start assessing the posterior thorax of my patient. I had to take off her shirt and turn her back to me. As my observation, the patient's spine seems to be in a midline position. The breathing seems to be normal and symmetrical. So, there is no use of accessory muscles. There is no obvious physical deformities, no masses, no swelling, no lesions or any redness. Now we're gonna check if my patient's anterior posterior diameter with the lateral diameter, and I'm just going to use my stethoscope. I'm just gonna fold it. So the ratio of it is 2:1, which is perfectly normal. We're just gonna be checking this to see if my patient may have the chest barrel and or barrel chest, and barrel chest may indicate the patients may have the COPD or the emphysema. Continue to palpate our patient's posterior thorax. We're gonna check the temperature or any masses. Ma'am, I will tell me if you feel any pain as I touch you. Okay. My patient's temperature is normal and there are no masses as per my palpate now. We're just going to palpate if the spine is really in the midline position. The spine is in the midline position. Now we're going to check for the tactile framing. Elaine, I want you to do is to cross your arms and tell me, and as I touch you, I want you to say 99, okay? 1, 2, 3, 4.
99, 99, 99, 99, 99, 99.
Okay. So, can you, okay, you put down your arms now. So, Elaine does not have any framitis. Now we're going to percuss Elaine's back to check if the sound elicited or to check any abnormalities. So there seems to be no abnormal elicited when I did the percussion. So now we're going to check for the patient's diaphragmatic execution. So the diaphragm is in here. So as we wait, the diaphragm seems to be here. So okay, I want you to inhale and exhale. So mom, I want you to inhale and exhale for me for later. So now we're going to start to escalate our patient. So I'm just going to check for any abnormal breath sounds. So we're just gonna warm our diaphragm. So just gonna start. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. So the breathe in out, there seems to be normal breath sounds elicited. So let's now proceed to the anterior thorax inspection. So we're now going to start inspection the patient's anterior thorax. So as per my observation, the patient has no masses, no swelling, no lesions, or the breathing seems to be normal, symmetrical, no use of accessory muscles, and the breathing has no shortness of breath. So could you inhale for me in a full exhale? Okay, so as we can see, the coastal margin seems to be symmetrical and of the 90 degrees. So now we're gonna check for the respiratory expansion, just like what we do in the posterior. So I'm just gonna put my thumb in the rib or the 10th rib and on the flap. So I just want you to breathe in. So I just want you to do is to inhale and exhale. Okay, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. So the inhaling inhalation of the patient seems to be normal, and also the exhalation is seems in the symmetrical both the left and the right side, so no abnormal expansion. So we're going to proceed to palpating the patient's anterior correct. So I'm just going to do the 99 again. And as I touch you, I want you to say 99, okay? Let's start now. 1, 2, 3, 4.
99, 99, 99, 99, 99,
Okay. So there seems to be no abnormalities or there is no frame. So we're going to precause our patient. So now I'm just going to place my finger again and process and start now. So start off with a resonant sound until we reach the heart and the liver. So okay, the sound of the elicited was resting from here, and it became more dull when it came to the heart and the liver. So now we're going to aspirate our patient. So I'm just going to place my diaphragm again, and I want you to breathe in. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. So the patient's breath sounds are normal.